Hello everyone, welcome back to my channel. This is RN Sakshi. So today I'm going to discuss about what kind of NCLEX questions come into your next generation NCLEX RN. In my first video, I have discussed about CAT adaptive system, that what is CAT. I have discussed about 95% confidence rule, run out of time rule and maximum length. So I will highly encourage you to watch that video prior to watching this video because it is the base. So your base should be clear always before you go or before you prepare for your NCLEX RN. So in this video, I'm going to discuss about the NCLEX scoring models, and we have subcategories. We have different categories of like how the question will be coming into your exam, like case studies, your matrix questions, drop down questions, etc. So I hope you are ready to start that session. So let's get started. Okay guys, so let's get started with our next generation NCLEX scoring models. So in this video, I will be covering about what are the scoring models for this NCLEX RN. So here they say the scoring models are systematic methods that are applied to a candidate responses. So they map candidate responses into measurable score points, which allows for inferences to be drawn on the ability level of candidate's knowledge or skill represented by them. So it's basically if I just tell you in brief, so scoring model allow like how you mark your answers in your exam, they will be just scoring it. So in previous NCLEX RN, what was like that, there was no partial credit system, right? In SATAs, if your all SATAs are wrong, your answer is wrong, right? But in this one, there is something different. So let's get started with that one. So here we have three subcategories which fall under scoring system. So as you can see, first is 0 to 1 scoring. What happens in this one is earn 1 point for endorsing each correct response. So that means if your answer is right, you will get 1 point. Earn 0 point for endorsing each incorrect responses. Of course, if your response is wrong, then you will not get anything. Like it will be 0. So total score for a multi-point item is the sum of all correct responses. Okay, so in today's video, I'm just gonna discuss about the 0 to 1 scoring method. So you have to be very patient so that we can discuss all these categories in brief, like what they are telling us about. So first is 0 to 1 scoring method. So the 0 to 1 scoring rule is a classic rule that traditionally has been used to score multiple choice items. Selecting the correct option results in earning a point. That means if you are selecting the correct option, you will earn a point. Selecting an incorrect option results in score of 0. So that's pretty basic. Like if you are answering right, you will earn a point. If you are answering wrong, you will earn a score of 0. This rule is applied to all single response items. So we will just see the examples behind it. So first is multiple choice items. So these are the basic questions which you get in your previous exam as well, in this one, the next generation as well. So these are pretty basic and you must be familiar with this item. So for example, there was a question, which of the following actions should the nurse take? For example, now you mark this one. So this is right. That means you will earn 1 point, right? But unfortunately, if you mark B, so that means it was wrong, you will earn 0. So that's pretty much basic. So the first category which we have in our NCLEX RN exam is the multiple choice questions, right? So you are familiar with this one, so that's pretty much basic. So this one is the main brief here that says that 0 to 1 scoring rule is also applied to multi-point systems. For these items, the total score of the item is sum of all correct options. Following are the examples, right? So we will see behind this category is, next category belongs to matrix multiple choice. So what happens in matrix multiple choice? For this item type, each row is scored independently with 0 to 1 scoring. 0 to 1 scoring we have already cleared that if you're answering right, you will earn 1 point. If you're answering wrong, you will be earning 0. And the scores for the rows are summed together to get a total score per item. As each row is scored with 0 or a 1, the maximum score is the total number of rows provided. So the following is example for the maximum score of 5 points. So in your exam, you will get a matrix type question like this box. Okay. So you will be having 1, 2, 3, 4, 5 options, right? So these are the questions, and these will be the subsequently there will be the answers for each and every item, right? So if you answer all the 5 questions right, you will earn 1 point. But if you answer one item wrong, then you will get nothing. You will be getting 0 point, as you can see here, right? So for example, this was your first question, right? That what will be the respiration of the patient, like is it improved, is it not changed, is it declined, right? So here if we can see that if the respiration is improved of the client, so you will mark that, right? So this will give you 1 point. And if this is not if this item is wrong, that means 0 point. Your answers are right here, so that means accumulatively you are earning 1, 2, 3 and 4 points, 4 total points, and 1 point is deducted because you marked that option wrong, right? So this is the partial credit system. So if you are answering 1 or 2 options wrong, that doesn't mean that your whole question get wrong, but that means you will be getting the partial credit of that items which you answered right. So till now I have discussed about one category multiple choice item which we are already familiar, right? So matrix type questions are like they will be giving you a case, a scenario. So we will be just discussing in our upcoming video. So like they will be giving you a case, and then they will be asking you, for example, you can see here that Mr. John was diagnosed with pneumonia, right? So he is having now productive cough and you can say sputum, right? So now as a nurse, you have to see that these are the assessment findings. Is the client condition is improving or no change or decline? Decline means like there is nothing, like the client's condition is not changing. So you can see here, for example, respiration is 36. So it depends upon the case, right? So improved and BP, like how it's. So as you can see in this one, so that's what I was discussing is like if your patient condition is improving, then you will mark this one. If there is no change, then you will mark this one. If it's not improving, then you will mark decline, because most of the students get confused that what is the difference between no change and decline. So decline means that there is no change, like no change means it's constant over there. Decline means maybe it's getting worsened, right? So it is not changing, okay? So no change means it was as it is, like BP was still 118/68 1 hour ago, and after 2 hours the nurse is checking, still it's 118/68. That means there is no change. But in the other case, if the nurse sees that BP is 118/68 at 10 a.m. but at 12 p.m. when she checks it's 140/70, that means it's not improved, it's becoming more worsened, so we will mark this decline, right? So don't get confused over here. So these are the matrix multiple choice items, like they will be just giving you a case and then some items, and then you have to decide that's improved, no change or declined, or they can give you a different subheading for that. So we can see here in this example matrix multiple choice item, the candidate has answered rows 1, 3, 4, 5 correctly, which results in 4 points. The candidate answered row 2 incorrectly, which results in a score of 0. So overall, this response pattern results in an item score of 4 points, right? So this was the total score was 4 points. So pretty much basic. Then we have is multiple response. Select N means the number. They will be telling you in the question that you have to select 4 choices. So for the select N multiple responses, each correct option is scored as 1 point and each incorrect option is scored as 0 points. So unlike the SATA multiple responses items, candidate is not able to select more than number options specified in the item stem. So same thing here, like if you are having SATA, right, they will not sometimes mention that you have to select the 4 findings, but sometimes they can mention you. So in this example, a candidate selected 3 correct options and 1 incorrect option, which result in a total score of 3 points. So again, there is no penalty is implemented for selecting an incorrect option. How much answers are your correct, you will earn those points. So for example, we can see here, select 4 findings that require immediate follow-up. Okay, so they will be giving you a case and then you have to select the 4 findings that require immediate follow-up. So from here we can see we have to select the 4 findings, right? So for example, you mark this right, and this right, and you mark this one wrong. So there is nothing to be afraid about, but you will still get, your computer will analyze your results based on these 3 items, not on this one specifically, right? So that means you earn 0 point for this incorrect one, but you earn 3 points for these 3 options which are right? But if we talk about SATA, so let's select all that apply questions. If they don't say that select 4 findings, like they will say select the findings that require immediate follow-up, right? So if still the same thing, so if you mark these 3 answers right in SATA, you will get the score of that, but if you mark this one wrong, you will not get the credit for this one, right? So that's known as partial credit system. So you will be earning for your items which you marked right. Next we have is here drop down close. So for this item type, 1 or more drop down responses options are embedded with a sentence or passage to create a clause type item. Each drop down is worth 1 point and is conceptually identical to a multiple choice item, though having a different response format. Points are accumulated by selecting the correct option in each drop down. Selecting the incorrect option resulting in earning 0 points. Pretty much basic again. If you are marking the answer right, then you will earn 1 point. If not, then you will earn 0 point. But your whole question will not get wrong. The total item score is the sum of all drop-down scores. In the following example, there are 3 drop-downs which indicates the maximum score is 3 points. So the candidate answered the first and third correctly but missed the second. So this response pattern resulted in an item score of 2 points. So pretty much basic. They are saying that the nurse have reviewed the nurse's notes entries from 1330 to 1600 and diagnostic results from 1330 to 1600. Based on the findings in nurse's notes at 1500 and imaging studies at 1600, which of the following actions should the nurse take? Complete the following sentences by choosing from the list of options. So there are 1, 2 and 3 options, right? But we can see here the candidate have marked 2 options right, so he will get 2 points, and this one was wrong, so he will get nothing on that one. So accumulatively, he will be earning 2 points on this whole question. The computer will analyze on these 2 questions, right? Your whole question will not get wrong here. So this is the basic thing which I'm trying to tell you. So we have discussed about, till now we have discussed, so multiple response, like number. They will be giving you the specific number, that how many items they are looking from your side. Like if they have given 4 findings, that means 4 findings, right? You have to find 4 answers. So SATA is like select all that apply. Maybe one question, maybe one answer can be right, or maybe more than one answer can be right? And then we have discussed about the drop down close, in which we have to click on this arrow. They will be giving you the options and then you have to select. Next here we have is drop down table. So this item is similar to drop down close, with the main difference being the drop down elements are located within a table rather than a sentence or passage. So now they will be giving you a table rather than a sentence or passage. As there are 3 drop-down elements in the example item, the maximum item score is 3 points. And the response pattern for this example resulted in score of 2 points. So we can see here, like complete the following table by choosing the potential nursing intervention per body system that the nurse should implement from the list of options. So same thing here. So we have discussed, right, the drop-down close item, right? So this was like, they are just giving the statement and now you have to select the options. Same thing here, they have just now given you the table here, right? So you will click on this and there will be list of options and then you have to select, right? So now for example, they have given you the scenario, right? So now you have to see that what the nurse will do to maintain this system. For example, neurologic, maybe she will be performing Glasgow Coma scale, right? So maybe that intervention you have to select from here by marking this item over here. So what will be the nursing interventions done for this particular body system? So for example, neurologic one, she did right. Respiratory, she did wrong. Cardiovascular, she did right. So if one of the item gets wrong, same thing, she will earn 2 points. Your whole question will not get wrong, right? So this is your drop down table item, which is enlisted in your table here, and you have to just select the possible intervention or your answer. So this will be making the clear picture when you will be actually doing these questions with proper cases. I'm just giving you the brief introduction for these ones. So next we have is bow tie. So here you can see the diagram over here. Like they will be giving you the condition which the client is experiencing, action to take, like what action or intervention will the nurse take, and the second, same thing. Other is parameter to monitor, like what will be the areas to monitor, right? And the 2 options for that one. So bow tie item will always have a maximum score of 5 points because there are 5 targets for the 5 correct tokens. So always the bow tie question will be considering of 5 points, right? Points are earned by selecting the correct tokens for their respective list and placing them on correct targets. Tokens for the action to take and parameter to monitor can be dropped in either of the respective targets. Candidate selected both of the correct tokens for the action to take in the example item and could have dragged them to either of 2 action to take targets. The candidate response therefore obtained 4 points, 2 for the correct to take options, so 1 for the correct condition most likely experiencing and 1 of the 2 correct parameters to monitor. So they're just explaining that what is happening over here. So in your exam, they will be giving you the nurses reviewing the client's assessment data to prepare the client's plan of care. For example, they have given you this case. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. 2 actions the nurse should take to address the condition and 2 parameters the nurse should monitor to assess the client's progress. So this is your bow tie as we have seen, right? So like condition most likely experiencing. So which conditions is the client experiencing? So for example, he was experiencing from hypoglycemia. The candidate choose right. He will earn 1 point of that. Actions to take. So like he's saying that administer oxygen at 2 liter via nasal cannula, obtain a urine sample for urine analysis and culture and sensitivity, right? So it depends upon the case and scenario. We will not be just looking at the options right now, but he selected right option, so that means he will be earning 2 points again. Then parameters to monitor. So for example, his vital signs, like his neurovital signs are not balanced, right? Maybe his temperature is high, maybe he's suffering from hyperpyrexia. So of course the nurse will monitor the temperature. So this one is good, right? But he selected one wrong item. That means he will not earn anything on this item. But still, because the bow tie questions are of 5 marks, so he will be earning 4 points in that one. 1 is deducted because of incorrect responses. So what will happening in this is, you have to pick this question and you have to just drag from here to this. Like in your software, when you will be practicing, it will allow you to practice like that. So you will be picking up this option and then you will drag this item over here. Same thing over here, doesn't matter if you have selected this option, drag over here and take over here. And same thing again, if you have selected this option, then you will be moving and dragging it down to here. Like there is no specific thing like that this item should be here and this item should be here. You can just drag them subsequently however you like. And again, same thing here, like dragging this option to here, and the other whichever the item is right, you have to drag over there. So there is nothing like that you have to be very cautious. It will take some time to get used to these questions. So I think this is sufficient for today's video. So overall we have discussed like very simple things, like it's 0 to 1 scoring, that is partial credit system, which falls under your multiple choice item, in which you have to select only one option and the question is given. And then matrix multiple choice, same thing here, like they will be giving you item and you have to see that is it being done or not done, or it's constant over there, like they can give you any different heading as well. Then we have discussed about the multiple response. Depends upon the select n means they will be giving you specific number, and SATA in which there will be no number, there can be one option or more than one option, and drop down close system in which they will be giving just blanks and you will be just filling that blanks depending upon the case. So you will be just you will be clicking on here and you will be selecting the appropriate answer for that. Drop down table means it will be enlisted in the table, as you can see. And then last we have bow tie. So of course it's like the bow tie. So you have 5 answers over here which you have to select. So this is the item which is considered in bow tie. So all was this about your 0 to 1 scoring. In my next video I will be making the video on plus minus scoring, right? So I don't want to overwhelm you by most of the content. So you just focus on these, and if you can just go on, or if you are studying from any software or Google or any other resources, just practice these questions on your computer, or like you can just review them so that it can create a clear picture in your mind. So it was just a brief discussion. When we will be starting our questions according to them, it will make more sense. That's what I'm talking. So thank you for watching this video. I hope you like. Any suggestions for me, if you want, so please like and share my channel so that more like most of the nursing peers can get advice and they can clear their horizons related to nursing topics. Thank you.